You know the drill, subscribe, like and tell us your next topic. Today Dr. Sharon is back to make assessment feel systematic, fair and Viva ready as a part of your prep for Pedagogy Viva for your MD exams in Community Medicine. This is third and last episode of the series on Pedagogy Viva preps for MD exams of Community Medicine. If you're new here, don't forget to check out episode 1 and 2 in the series.
Let's define the landscape. Assessment for learning is formative with ongoing feedback to improve. Assessment of learning is summative with judging the final achievement. Also remember diagnostic before instruction and performance-based assessments for practical skills.
And the classic assessment versus evaluation distinction?
Assessment measures learning. Evaluation judges overall value or quality.
Let's zoom into MCQs. What are their parts?
STEM, key and distractors. Simple rule of thumb, about 1 minute for a straightforward item up to 1.5 to 2 minutes for complex scenario-based items.
How do we improve item quality after an exam?
Do item analysis. Check difficulty index, ideal around 0.3 to 0.7, and discrimination index positive, preferably above 0.2. Also review distractor performance. Pre-validate with expert review, post-validate with analysis.
Dr. Sharon, which are the types of MCQs?
Single best answer type, true-false, multiple true-false, extended matching, and assertion reason type. Each can target different cognitive levels if well written.
What about modified essay questions?
They can be scenario-based, evolving clinical cases with short answers, and are excellent for application and decision-making.
For clinical skills, we hear OSCE, OSPE, OSLER, and DOAP a lot. Briefly?
OSCE is the Objective Structured Clinical Examination, station-based assessment of clinical skills. OSPE is the Objective Structured Practical Examination, structured labs. OSLER is a structured long case record to enhance objectivity. DOAP is demonstrate, observe, assist, perform, stages for teaching and then assessing practical skills.
Where does CBME fit?
Competency-based medical education is outcomes-focused using frequent programmatic assessments across tools, OSCEs, portfolios, logbooks, direct observation, multi-source feedback and entrustment professional activities. Community medicine certifiable skills include health education sessions, immunization, basic epidemiology calculations and organizing camps.
Dr. Sharon, we talk outcomes all the time. Anchor this to the Indian medical graduate roles for Viva answers.
Think in 7 crisp roles. A clinician to deliver safe, effective, ethical patient care in varied settings, a leader to manage teams, resources and quality improvement, understand systems, a communicator to build trust, explain clearly and document responsibly, a lifelong learner to keep learning, appraise new evidence and adapt practice, professional to uphold ethics, accountability and sensitivity to context and culture, critical thinker to analyze data, solve problems and make decisions under uncertainty, and a researcher to ask relevant questions, use appropriate methods, and apply findings.
And for assessment mapping?
Link each role to observable tasks, teaching sessions, field visits, audits, brief research projects, and reflective pieces. Use multiple tools, direct observation, rubrics, portfolios, and multi-source feedback to see consistent performance, not one-off spikes.
Viva tip, state all 7 roles, then give one concrete example of assessment for any 2. Vignette. You must assess a 250 student cohort at the end of a single session. What's practical?
Exit tickets or 1-minute papers for quick formative data or digital polls for instant class-wide feedback. Simple, scalable, and aligned to your SLO.
Technology is great until it isn't. What are the common pitfalls with tools like Mentimeter?
Mentimeter is an interactive presentation software that allows presenters to engage with their audience in real time. Participants use their smartphones to respond to live polls, quizzes, and Q&A sessions during a presentation. There can be connectivity glitches, unequal device access, risk of cheating, and the faculty learning curve. Always have a paper or discussion backup.
Plickers or clickers, worth it?
Plickers and clickers are simple tools that allow a presenter to get instant answers from an audience. Plickers use special paper cards that students hold up, which a teacher can scan with the phone, making it perfect when students don't have devices. Clickers are small handheld electronic buttons that each person uses to vote or answer questions. Both are great for providing immediate formative feedback to the presenter on what the audience understands.
Managing learning data at scale, LMIS?
A Learner Management Information System or LMIS centralizes content, tracks progression and supports personalization. Handy for programmatic assessment.
Self-directed learning, define and assess.
SDL means learners initiate, plan and evaluate their learning. Assess through portfolios, reflective journals, goal reviews and observation of initiative and resource use.
Dr. Sharon, we defined self-directed learning. What sits beyond that? People mention heterogogy.
Heterogogy is self-determined learning. Learners not only plan and drive their learning, they also shape what outcomes matter, adapt pathways as they go and develop capability, the confidence to apply knowledge in unfamiliar changing contexts.
Sounds like the mindset we want in community settings where problems rarely look textbook.
Precisely, practically offer open-ended projects, let residents co-design rubrics and include reflective checkpoints so they recalibrate goals based on field realities.
Exam tip, define it, contrast it with self-directed learning and add one concrete example, perfect short answer. Now any facilitation mantra for small groups?
Remember F.I.R.E. Facilitate, inspire, reflect, engage. It keeps groups purposeful and energetic.
Final pause and recall. Name 3 post-exam checks to strengthen your MCQ bank.
Difficulty, discrimination and distractor analysis. Then revise items or retire them accordingly.
If these 3 episodes helped you feel calm, crisp and Viva ready, subscribe, like and share with your MD batch. Comment your next must-have topic for MD exam of Community Medicine. Your suggestion might launch our next viral episode.